Welcome to Introduction to Radiologic Technology Pathology. And this is chapter one. It's going to be kind of a basic introduction to terms and concepts. So, what you ultimately need to take away from this course are going to be some of the most common, and some might be less common, but still significant in radiology, rad tech pathology. So, some of those common and significant rad tech pathologies and the primary affected populations. For the most part, this just means whether they're mostly a pediatric disease or if it's in the entire population, if it's adult only, maybe it primarily affects the elderly community, things like that. And also the basic descriptions and definitions of these. And finally, how each might be or affect the technique that you choose ultimately. All right, so pathology is the study of disease processes through medical imaging like X-rays, CT, and MRI. All right, so disease. This is the pattern of the body's response to some form of injury that causes a deviation from normal conditions. It could be hereditary or congenital. It could be due to trauma, a condition or disease due to trauma. It could be spontaneous. Believe it or not, there's this thing called a spontaneous pneumothorax or spontaneous hives. It could be an infectious organism, such as what we saw with the COVID-19 pandemic. It could be a vascular process and a metabolic process. So the main or a diagnosis is the identification of a disease or condition based on a patient's signs, symptoms, medical history, and diagnostic findings. So we collect information, right? We observe the signs, tests are big, that's where we mostly come in. And then the physician ultimately applies clinical reasoning. Now, why would we learn about rad tech pathology if we can't diagnose legally? Well, as mentioned previously, it does affect the way we take an X-ray, and it could even affect which views you choose to do, and also your expectations from the patient. If the patient has trauma to the ribs or broken ribs, for example, you would modify how you do the breathing instructions. All right, back to those terms we were talking about. I mentioned congenital versus hereditary, and I wanted to separate those out in our minds real quickly. So, congenital is a condition present at birth, but it could result from genetic factors or environmental exposures or even a combination. But an example of this might be cleft palate or a congenital heart defect. So, it's present at birth. Hereditary is specifically something passed down from parents to their kids through the genes. It's not relevant to things like environmental exposures. An example of this might be cystic fibrosis, and that's something we actually learn about and take a look at on X-ray when we talk about the respiratory system. Another one I wanted to differentiate was vascular. This is metabolic, in case you weren't sure what the difference was between those two. So a vascular process, this is something that vascular systems move substances to and from the cells. So we're talking about systems that support life by delivering and removing materials through blood flow. And we'll take a look at the vascular system and those pathologies when we get to like um, the areas of the heart, for example. The metabolic processes use those substances inside the cells. So they sustain life by converting materials into energy and cellular components. So that's down to like the blood cells and how we might process proteins and things like that. All right, so terms related to disease. Moving on here. Signs versus symptoms. Signs are something that we can actually measure, for example, temperature, body temperature, while symptoms are something that's reported by the patient. So they might say they have a headache, but there's really no way for us to measure that. We could find a cause, but we can't measure the severity of a headache, for example. Asymptomatic would mean without symptoms. We'll see this, for example, with a bone cyst. That's something that can happen in like pediatric patients. They might have a cyst within the bone that they may never know about until the bone becomes weakened and maybe a fracture occurs. So, what I'll need you to do is go ahead and go through this, focus a lot on idiopathic and unknown cause, and iatrogenic disease caused by a physician or treatment, and run through this list and kind of get comfortable with it. Iatrogenic, by the way, is this might be something like a catheter, for example, was inserted and a uh, infection was caused as a result. That would be an example of iatrogenic. All right, inflammation. This is our body's initial response to local injury. It's an early response where the body starts to react. We get dilation of arterioles and capillaries. There are clinical signs such as redness, heat, and swelling. We have seen inflammation before, and I want us to go back to that because we saw it in the stages of healing for a fracture. And pretty soon we're going to focus a lot on fractures and actually start to name them and identify them. So, just as a reminder, osteocytes are those mature bone cells. Right? They're kind of maintaining bone there. They might signal that injury has occurred and set the stage. Phagocytes begin migrating to the site, and they're going to start clearing dead cells and debris, help clean things up. Chondroblasts are another one we learned about. They bridge the fracture gap, so they're going to start to lay down a soft callus. Then we're going to try to build that bone back into something solid with osteoblasts. Remember, we said B for build new bone. And they'll eventually become osteocytes that help coordinate remodeling and try to keep things back to normal. Osteoclasts are also at this stage remodeling to reabsorb excess or poorly aligned bone. The body will generally try to get things back to normal. All right. Other examples of inflammation, you may see a term such as keloid. That's excessive amounts of reparative collagen. Within the abdomen, formation of scars can narrow loops of bowel and lead to obstruction. In the liver, repeated and persistent injury from alcohol can result in inflammation, even a chronic disease of the liver, things like that. So we might hear about inflammation in different ways. Edema. This is a term to become familiar with, especially before we get into the respiratory system. Basically, it's just an accumulation of abnormal amounts of fluid in those tissue spaces, like intracellular tissue spaces. Something like this is edema here, and gravity is making it even worse than it should be. You can see the size difference, but things like congestive heart failure, kidney disease, and liver disease can definitely contribute to the occurrence of edema. Pulmonary edema, like I promised, we'll eventually learn all about that. What I wanted to do is take a moment and show you. Now, for sure, we can see it over here, right? And this would be an example of an additive disease. An additive disease is anything where fluid or tissue is added in. And if it's additive, it generally needs an increase in technique, not by a whole lot, but to do things correctly, best practice, we would increase our technique just slightly for this. And we're used to regular chest x-rays by now, so we know that we should see something dark here where the lung field is, right? Instead of this kind of cloudiness that we see there. On the other hand, a pneumothorax that we'll learn about within the next couple of chapters is an example of a subtractive or destructive disease. So this is going to require a decrease in technique. So here we have air. If something introduces more air than should be there, or if it generally eats away at tissues, almost makes them kind of disappear or degenerate, we're talking about a destructive disease, and we should decrease our technique. All right, ischemia is another term to be familiar with. Ischemia refers to an interference with blood supply to an organ or part of an organ. So this is where we're getting into kind of those vascular processes. And it could be caused by narrowing of an artery. We're also going to learn a lot about thrombus and embolus. So keep those two terms kind of in mind as we go forward. And I wanted to show you quickly different levels of ischemia, right? Things are kind of building up. Something's preventing the amount of blood that's normal flowing through our vessels from continuing on. And in an axial CT scan here, these darker parts are where we're not seeing the contrast fill the anatomy like it should. And that's because there's generally like a plaque there. Something is blocking the contrast and basically the blood from passing through right there. Infarction, that's where we're no longer getting blood flow. So it's the tissue is starting to die because its arterial supply or venous drainage is just no longer happening. And that was a picture of gangrene that we saw. Hemorrhage here. And I wanted to show you the difference that it might look like versus ischemia that we were just talking about. But hemorrhage is the rupture of a blood vessel that allows blood to escape within surrounding tissues. So it's actually, blood, bleeding, active bleeding into tissues. And then it can result in a hematoma. Once that blood is kind of kept there in one kind of place, you're looking at a hematoma, kind of like a bruise, you might say, on the skin. That would be another version of a hematoma. All right, summary of terms related to blood vessels. Go ahead and go through those. Let's see what else. Alterations of cell growth. Atrophy is the reduction in size or number of cells. And you can see that correspond with, an actual decrease in organ size or part size sometimes. For example, if someone has a cast on and they lose the, functionality of maybe their wrist or, their forearm, over time, you'll see that part atrophy as the cells, there's a reduction in number there. Carcinoma is a malignant neoplasm. Malignant is a term you don't want to see. It implies that something is bad. And it's a neoplasm of the epithelial cells. Epithelial, I'll give you a note there. It's, for example, the skin, mucous membranes, glands, linings of the organs is a big one. That's where we see a lot of carcinomas kind of originate. And then sarcoma is a highly malignant tumor originating from connective tissues. All right, summary of terms for alterations. Make sure you go through that. Carcinoma, sarcoma, I'm going to pause on those. And then here's a big one. I would take a closer look at this table, morbidity and mortality. For example, if we were going to separate those out along with the word prevalence, morbidity is the presence of a disease or the complications caused by it. So it's kind of just, it's the presence. Mortality is going to be when, like, for example, the Centers for Disease Control take a look at the number or rate of deaths in a population. Prevalence is kind of close to morbidity, only prevalence is the total number of existing cases, new and old, in a population at a specific time. So it's very focused on a time period or even just, the present. And that's it.